Hi everyone. Today I have come up with one interesting topic, that is computer uses in medical and data entry. I think you might have a familiar about this topic because in this era, in this generation, nothing is happening without computer usage, right? Now we are going to see what is the computer applications in medical sector, that is especially in the hospital. How this computer is playing a very big role. That is the big role. That is today's topic we are going to discuss. Let's just I'm going to give a short glimpse of the major applications where the computer plays a vital role, right? Apart from this, we have a variety of different kind of application. But in this class, I'm just going to focus on very few things because a computer is like it's like you can't see any place or any application without computers. Okay, so if you see the application in terms of hospital, in the sense there are certain things which where the computer is very mandatory. That are the things we are going to discuss in today's class. Okay, so there are few set of application where the computer presence is very mandatory. The first one is the medical and patient data. Second one is to monitor the patient, and third is research and studies, and fourth is inventory, and fifth is medical imaging and equipment, and sixth one is communication and telemedicine, and fifth next one is the patient and staff scheduling and augmented reality, and last but not least that is the assessment management. So these 10 area or domain, whatever so called, here the role of computer is very important. Let's see how this is why it is very important. Because if you see the medical and patient data, uh, this is something like very important. Okay, so in earlier times they used to maintain the data of patient in some paper based thing. So they will follow one file. Even these days also following the same thing in most of the hospitals. So I'm saying that that files carries the all details, all data about the patient, right from the patient history to till date treatment prescription, diagnostic results and so on. So this record will be maintained in the hospital for each patient at least 5 years. It's follow some sort of regulations. Okay, they just maintaining for 5 years. After each 5 years they have to discard those files, and they will be refilled with other new set of patients. Okay, so it means that in some hospitals they may be followed for 10 years or 15 years, but it will not be followed more than 15 years because it very tedious process, right? Because the paper quality will get degrade over period of time, and then it required a large amount of space to occupy the n number of files. Because we are not having one patient, we are not dealing with one patient, we have n number of patient and visiting our hospitals. In that case, if you want to measure, if you want to maintain the data of all n number of patient, means it will like very tedious, right? So that is the case here. We have a solution of using the computers, because based on the computer storage capacity we can store the n number of patient data. Again, we have some limitation of memory space, but somehow we can manage by using some external or peripheral device to extend the memory space, and we can have the recording of data for prolonged years. Okay, even a hospital doesn't need to maintain the records of patient more than 10 to 15 years, but patient need for their whole life. So if it is a if we have soft copy or storage data, then we can easily give one copy to the patient. They can have it for their long life. So that is the major role. We can have we can have the computers here to play very big role in order to manage the medical and the patient data. If second one is the monitor the patients. Okay, so the monitoring patient is not simple thing. We have to monitor the patient vital signs for 24 cross 7, and we have to record the vital signs, and whenever the some abnormality indications are there, we have to have very good track or follow up to identify where when the person having some abnormalities, or they are facing some difficulties. So in that case also we need the computer support in order to have visualization of the data, or you can have the storage of data for so many hours, and we can have the analyzing part even after some time. Okay, so that in this way we can have a we can use the computer in order to monitor the patient. And third and foremost important is like research and studies. Okay, so research is like doing so many things, doing some kind of it needs some kind of trial and error methods. We have to like there are certain things we have to do again and again. The repeating mechanism is happening in research. In that case, if we have support of computers, we can have the like simulation part. Okay, we can simulate and see the results. And also when we are dealing with the n number of enormous amount of data, it is very hard to analyze each and everything. So if we have the AI tools or some kind of algorithms, by means of that we can analyze the different data. Okay, we can have some conclusion of what is all about. So in this way we are this in research and studies without computers, it's very tedious process for the scientists or researchers or the doctors to have some kind of research, or to do the research, or to conduct the clinical trials. So that is the third thing. And fourth thing is inventory, that is a managing medical supplies and equipments. This also is a very much important thing to be considered here, because the managing medical supplies equipment is equally important as like managing the patient, because without this we can't manage the patient. So the medical supplements entry inventory, like when it's coming inside, what is the like maintenance date, how many times has been maintained, when you have to be troubleshoot, like that we have some inventories when it's coming inside, when it's going outside, in which department having how many set of equipments, is which device belong to which department. Like this we have so many things. If you take one device, we have so many columns to be entered. So that things we can maintain easily in normal excel sheet, because the documentation work like but because the whenever emergency need, the device has to go from one place to another, and the tracking mechanism is very difficulty when you follow the documentation process, documentation type of inventory. So if it is a excel sheet, we can easily have some kind of shortcuts also there in the excel sheet. We can easily find out which device is there in which area, and how can we shortlist the devices based on the areas, or based on the device, or based on the manufacturer or model, or inventory date, or preventive on maintenance date, and so on. So in this way the computers, it's playing very big role here. And medical imaging and equipment, it is very good, very known example, I think. Like because when if you once get into x-ray or ct and mra, we have one room that is a control and console room. In that we have computers which will control the whole big equipment throughout the treatment or throughout the scanning process. Okay, so without that we can't control the device. So there again the computers plays a vital role. Next one is communication and telemedicine. This is the most important and trending research area, is that because this communication telemedicine is nothing but we are promoting the quality of health over the remote areas. Okay, the patient will be in one end, and the healthcare professionals or doctors will be other end. Through the telemedicine, through the intercom or video conferencing, the doctor is giving the suggestion prescription to the patient by seeing the data of patient, the patient vital signs with the help of wearable sensors. All the vital signs through the internet, it is being transferred to the patient doctor and the doctor after reviewing those data, they are giving the prescription. So in this way we are promoting the healthcare quality of healthcare by means of video conferencing at remote areas. So this is the one kind of application. Third one, next one is the patient and staff scheduling. This is very important, even though it is very basic, but it is very important because the each doctors, okay, for each doctors the n number of patients will come to visit them. So the managing the staff and also the ratio of patient and doctors has to be maintained. And also the waiting areas, the patient, most of the patient they will feel disappointed, or they will feel frustrated because of no proper staff scheduling or patient scheduling. That is the appointment to meet the doctors. So if you have a managing if you are proper if you are have a proper channel to meet the staff, means it will make it will make a patient as well as staff's work to be easier, because the value of time is important for both patient as well as the staff. So the without proper scheduling, without the proper ratio, what is without knowing about what the proper ratio has to be maintained to have your proper scheduling, also everything will get collapsed. Again, normal scheduling plan will it won't be work in that much. It will work only in some extent. So in that case, if we have a computers, means immediately we know, even the doctors will know how many patients are there. According to that, they can prioritize their work, as well as the patient also they can prioritize their visit based on the appointment, at what time, at what date they have. So this is the one very good application where the computer is being used widely. Next, augmented reality is the top notch application. Like you can see the trending applications where the computer is very much needed, or especially when the patient is when the doctor is doing some kind of surgery. And also they can use for medical training for medical students. And last one is assist management. Okay, so assist management is like maintaining the assets of hospitals. So the hospital is like not 10 cross 10 room, it's like a very big infrastructure. So it has different rooms, different departments. In each departments it has different medicines. So, I mean medical pharmacies, tools, and so many things are there. So the tracking and maintaining of these assets is like, again, it's very tedious process. It's like it's not that easy to put one note and marking or note downing each and every department, and it contains what a medical device and stools in tables, stretchers, and so on. So then that's why for managing this asset, also we using the application of computers. With some software we can have some kind of analyzing method to assess the what is the status of hospital asset. So this is again one good examples. Okay, so these are the main area where the computer application is very much needed. It's playing very vital role, and it is not limited to this, and we can see everywhere. Okay, like even for laundry, even for canteen, that is like a CSD department, a central sterilizing department, and also like a food canteen dietary department, also they are having the computer supports, like at which patient, for what patient at which time we have to give what food. And also the sterilizing also at what room, like which room we have to sterilize the bed cottons, bed cloths, and their gowns, and so on. So like they will having some tracking process by with help of computer they can have some kind of tracking process will to be in so easier method. So that is the major main thing where computers is supporting in great way. Yes, thank you.